Hi, welcome back to the unemployment series, and in this segment I'll be using different stories in the economy that are related to or are caused or are a consequence of the unemployment situation in the country. Remember, unemployment is also a consequence and a sign of an economy that isn't performing as it should. My name is Susan Wanjiku. I'm the founder of Wanjiku's Eye, and here I discuss the relationship between economic development and governance so that you can understand, engage, and influence the matters that affect you and I. Welcome to Wanjiku's Eye. Now, at the beginning of the year, the Kenya National Bureau of Statistics released some interesting statistic implying that 67% of Kenya's jobless had given up looking for work or starting businesses. That translated to about 2.01 out of 2.9 million Kenyans without jobs. And that's a very discouraging statistic. Number one, and this one for me is the biggest thorn in Kenya's flesh, which is corruption and fixing inefficiencies in government institutions. Now, in all the reports that I've read, the government never fails to mention how corruption is a problem to the performance of the public institutions and the economy overall. It's like the government is writing a note to the government about how the government needs to work on the government. Even in the report on unemployment in 1980, the government said that one way that the government will deal with unemployment is by fixing the mismanagement of public investments. 50 years later, we're still having the same conversation. So the government has been saying it's working on corruption, but mimi sioni, and not just in Ruto's government, but all of them. Guys, it's easier for a country to get away with poor ideas but low corruption, but it's extremely difficult for a country to get away with rampant and obscene levels of corruption, even if they have the best and most creative ideas. And that's the curse of Kenya. So the examples of mismanagement of public investments and institutions are many, but let me use a most recent event, the salary heist, as an example. Now, the Controller of Budget, Margaret Nyakango, exposed how the government has been inflating the salaries of public officers for years, and obviously who has to pay for it? Kenyans, through our taxes. Watch this video.
I found out that my salary was budgeted at 3 times what I'm paid.
In light of this, NTV took a deep dive to get an understanding of just how much monies could be lost through loopholes in the name of inflated salaries. With supporting documents, the findings are mind-boggling. It is a shocking revelation that this is a trend that may have been going on unnoticed for years on end, and hundreds of millions, if not billions of shillings have disappeared through this budgeted corruption. On a sample of a few officers drawn from only 8 institutions and paid through the Consolidated Fund Services, a comparison between the salaries gazetted by the SRC vis-a-vis what the National Treasury budgeted shows that in excess of 90.8 million shillings was budgeted to be stolen. To give you a better understanding, the President and Deputy President are supposed to jointly earn a sum of 32 million and 51,000 shillings 256 as their salaries for 1 year, according to what has been gazetted by the SRC. Yet the Treasury has budgeted for 42,439,881 in the current financial year 2023-2024, a discrepancy of 10.3 million shillings. The Auditor General's actual salary for the entire year is 11.4 million shillings, while what is budgeted for is 21.5 million shillings, again having a discrepancy of 10 million shillings. At the Independent Electoral and Boundaries Commission IEBC, Commission Chair and Commissioners all pulled together are supposed to earn 78,055,596 shillings per year, yet the Treasury budgeted 27,759,526 shillings more, thus totaling to 105,815,122 shillings. The same inflation is seen in the salaries of Commission on Administrative Justice, CAJ Chairperson, the National Gender and Equality Commission Chairperson, the Director of Public Prosecution and the Attorney General, where an inflation of 17.8 million, 7.9 million, 108,000 and 7.8 million shillings was made. The total actual salaries for the 8 officers, mainly commissions and independent officers, is 171 million, 115,764 shillings, yet the one budgeted for by the Treasury is 261 million, 967,310 shillings. That is to mean that a whooping 90 million, 851,546 shillings is designed to vanish into thin air through this structured and budgeted web of corruption. When contacted for comment, Treasury CS Professor Njuguna Ndungu said, and I quote, "I have looked through our data and I do not seem to get a hold of the issue. I may need to talk to the source of the debate," end of quote. And after a further probe, the CS goes ahead to say, "I sent your questions to the Auditor General because it was raised by the Controller of Budget. We wait for her response, please," end of quote. Ibrahim Karanja, NTV.
Now, I want you to imagine this. If 1 billion Kenya shillings per year is stolen from just a sample size of 8 public officers, can you imagine what that means for the thousands of government employees? How many public officers' salaries are being inflated? How many people can that employ if that money wasn't stolen? How many doctors, teachers, and police officers can be hired? This money can be used for development projects, it just reduces the tax burden on Kenyans. Because the heavy tax we pay is going to fund theft and people's extravagant lives. And also, aside from inflated salaries, we haven't even gone to the issue of how much we lose to ghost workers. So this is not even an issue of political parties, if you support Ruto or Raila. We just have to admit that we have a serious problem in this country. Now, let's move to the issue of unemployment of doctors and teachers. And for this case, I call it a paradox of shortages and excesses. Now, ideally, it's impossible to have both a shortage and an excess at the same time. The two cannot exist, and if they do coexist, there's a problem somewhere. And I'll start with the situation of the unemployment of doctors in the country. Now, statistics show that we have about 5,000 doctors and medical practitioners who are unemployed. And the majority of them are young doctors, especially those who had not gotten a job by 2017. Now, the irony is that we have a shortage of doctors in the public hospitals, and the government has said that the reason that they can't employ these doctors is because they don't have money. But regardless of the reason, we can't run away from the consequences of having a shortage of doctors, from long waiting lines to shortage of specialists and doctors being unavailable altogether. And because of that, patients are forced to go to private hospitals even though they can barely afford it, because that's where they'll find the doctors and the specialists. And in fact, it's become easier to find doctors in their private practice, in their private clinics than in public hospitals. But unfortunately, the fact is that a majority of Kenyans cannot afford that option. And on other occasions, it's interns sometimes attending to patients without the supervision of specialists because they aren't available. Remember, these are human beings that we are talking about, and some mistakes made by these doctors are irreversible. As I always say, health sector issues are a matter of life and death, literally. Then the shortage also subjects the doctors who are employed to some very poor working conditions and unfair terms, like working for very long hours, no leave days, no medical cover, and no study leave. And the effect is that you end up with doctors who have burnout, depression, drug addiction, and other issues. And all these things put the safety of a patient at risk. And aside from that, in the previous episode, I mentioned that one of the ways that the government is trying to reduce unemployment is by funding people so that they can acquire skills through interventions like HELB. And specific to the case of doctors, the government has invested in building more medical facilities and hospitals in the counties. However, whether it's due to uncoordinated efforts or a lack of commitment or wasting funds, whatever it is, the government's efforts have been very counterproductive. We've ended up with situations where doctors can't find jobs, and hospitals in the counties that are either incomplete or don't have the necessary facilities, or hospitals without doctors. A ridiculous situation. Now, because the doctors can't find employment with favorable terms, some even end up abandoning the practice. And worst case scenario is that we've had cases of doctors committing suicide. So keep in mind that replacing doctors actually isn't cheap unless you intend to import doctors, because it takes approximately 7 years to train a doctor and almost up to 5 million Kenya shillings. That's about $45,000. So what's the point of all these policy interventions and investments at a personal level or at a government level if the doctors won't get jobs? And all this leaves one to ask, like, would a majority, if not all of these consequences, be avoided if the employment situation in the medical field was different? And also, what does that mean for our health sector in the future? And the situation is the same with the teachers. There's a shortage of about 100,000 teachers in schools, yet we have over 300,000 teachers who are unemployed. And the same scenario, schools are unevenly distributed within the counties, but still some schools don't have teachers. I mentioned that where demand for labor is less than supply, you typically have a lower bargaining power. Now, a few months ago, the Salaries and Remuneration Commission was under fire for recommending the counties to reduce the salaries of the early childhood development and education teachers, ECDE teachers, by up to 50%. So after the adjustment, the ECDE teachers would earn just somewhere around the minimum wage. So that's about 15,000 Kenya shillings as the gross salary. Mind you, this is before we've made the statutory reductions. Again, the SRC, the Salaries and Remuneration Commission, later justified the recommendation by saying that it was for the sake of affordability and fiscal sustainability of the wage bill of the county governments. Interesting reason, but I'll get back to the issue of salaries and employment terms. Now, for the teachers, most definitely this means that if you're earning 15,000 shillings in this Nairobi, surely what kind of life is that to cater for all your living expenses? Now, there's another thing that we don't talk about, and this is teachers taking out their frustrations of the horrible terms and conditions on their children. So we've heard of instances where children, kids are beaten to death by their teachers. But anyway, what's the greater impact of unemployment of teachers to the education sector? What does this mean for the students? Number one, we compromise on the quality of education that our children get. So if the number of students per teacher is high, some kids don't get the attention that they need. But even aside from the numbers of the teachers, what are these teachers also qualified to teach? Remember, in my previous video, I mentioned that one of the things that the government has been doing to deal with unemployment is to make sure that by the time kids are done with school, they have enough relevant skills. Therefore, if you compromise on the quality of education, you're directly and negatively affecting the skills that the kids end up with. What does that mean for the future? It's very simple: more unemployment, poor pay, or jobs without dignity. So basically what we're experiencing today. And the worst thing about our education system is that it's never enough, because a majority of people will always have to supplement their education with more and more training in this country. Yet in some countries, a high school diploma can be enough to even get you a decent job. And getting a master's degree or a degree is a big deal. But here we even devalue degrees and mock graduates, because degrees are not that much of a big deal anymore, because then you're overqualified but not really in a good way. Then another consequence when the supply of labor is higher than the demand for labor is that the terms of employment have changed, and not in a good way once again. For example, companies all over the world prefer to employ people temporarily instead of permanently. The reason for this shift is that business has become unpredictable and the labor laws are too rigid. Now, the labor laws are there in the first place to protect workers from being treated unfairly. So this shift from permanent to temporary employment has made it easier for companies to hire and fire people and cut their salaries randomly. Now, the Central Bank of Kenya did a survey called the Financial Access Household Survey, and they found that approximately 9% of Kenyan adults have permanent jobs, while 28.5% are casuals. 13.5% are self-employed, and the rest get their source of livelihood from agriculture, and the larger majority depend on others for survival. This means that even though most people have some form of employment, they still don't have job security, are probably paid in cash, and don't have medical insurance and pension. Another instance of unfair treatment, again, is with the issue of salaries, the salaries of the ECDE teachers that I mentioned earlier. And this country never ceases to amaze me. So while the ECDE teachers who earn close to the minimum wage are begging the Salaries and Remuneration Commission not to reduce their salaries, the MCAs who earn almost 10 times more than these teachers were demanding a salary increase from 144,000 Kenya shillings to 400,000 Kenya shillings. They justified their demands by saying that they have too many statutory deductions like mortgages, car loan payments, etc. I get what they're saying, but this is just the attitude of entitlement that we see with politicians. Everyone in the country is struggling at the moment. They're not the only ones who have such deductions. So why should they be shielded from the consequences of poor governance and a struggling economy? The cost of living is high for many Kenyans, many of whom haven't received a salary increase as compensation for the increase in the cost of living. And the same applies to the doctors. Whenever they protest demanding for better pay and better working conditions, they get arrested and even get threatened with losing their practicing license. And if I remember well, a deadlock between the doctors and the Kenyan government led to the Kenyan government importing about 120 Cuban doctors, claiming that it's an exchange program to bring in specialists. But considering that the amount that the Kenyan government was paying for each Cuban doctor, about 125,000 Kenya shillings per doctor, plus 500,000 Kenya shillings to the Cuban government per doctor, and yet here we have doctors who are underpaid while others who cannot be employed because the government doesn't have money. The math is not mathing. Plus, the government had to cater for other perks like security, providing furnished homes, holidays, electricity, and other utilities, and other expenses. So it's very expensive. There's no justification for that. By the way, there's nothing wrong with exchange programs, but for them to say that they don't have money to hire doctors locally, yet make such a large investment for such few doctors, it doesn't make sense. Anyway, in the next video, I will be touching on HELB, the Chief Administrative Secretaries, and the maize in Zambia issue. Yeah, so if you enjoyed this video, make sure you give it a thumbs up, share it within your circles, and leave a comment down below. And as always, do not forget to subscribe. Thank you so much for watching. I will see you in the next one. Cheers.